Mr. Speaker, there is a better way to move forward. We need the right type of reform that will actually improve outcomes while reducing costs and protecting vulnerable persons. I yield back.
Gentleman from New Jersey, does he continue to reserve?
Yes, Mr. Speaker.
Gentleman reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 1 minute from the gentleman from New York, Mr. Grimm.
Gentleman from New York is recognized for 1 minute.
Thank you, Mr. Speaker. When I was elected to Congress, I made a promise to the people of Staten Island and to Brooklyn to repeal Obamacare. And tomorrow, I will vote again to uphold that promise. We must repeal this overwhelmingly burdensome and costly law, which is hurting our economy and impeding job growth for small businesses. It will reduce the American workforce by as much as 800,000 and impose $813 billion in 21 new taxes. 12 of those taxes impact families making less than $250,000 a year. One of the most devastating provisions within Obamacare cuts over $500 billion from Medicare, primarily Medicare Advantage. I have 107,000 seniors in my district, 38,000 of whom are enrolled in Medicare Advantage. This is simply reprehensible, and we must repeal this law to protect our seniors and our economy. Thank you, and I yield back.
Gentleman yields back. Gentleman from New Jersey continues to reserve.
Yes, Mr. Speaker.
Gentleman from Pennsylvania.
Mr. Speaker, at this time I yield 1 minute to the gentlelady from New York, Ms. Burkle.
Gentlelady from New York is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I rise this afternoon as a nurse and someone who has spent their professional career in health care. I ran for Congress because I was opposed to the Affordable Care Act, and I stand here today after 18 months of listening to the people in my district that this law is the wrong law for health care reform in the United States of America. When I hear from my hospitals, my skilled nursing facilities, my physicians, I hear from small businesses, and I hear from my seniors, they're all in fear of what this health care law is going to do to them. So I think it is incumbent upon this body, we have a responsibility to the people who live in the United States of America to provide them with true health care reform, reform that truly reduces the cost of health care and improves access to care. And this Affordable Care Act that was just declared constitutional by the Supreme Court is not the way to do that. And I yield back my time.
Gentlelady yields back. Gentleman reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 1 minute to the gentleman from South Carolina, Mr. Mulvaney.
Gentleman from South Carolina is recognized for 1 minute.
Thank you, Mr. Speaker. You know, I've heard a lot of good reasons today to pass this bill and repeal the law. What I haven't heard is a discussion about why we should pass it in order to help the President. We have an opportunity here to do something wonderful. We have the opportunity here to help the President keep one of his campaign promises. It's here in bright white letters on a wonderful orange background. I can make a firm pledge under my plan that no family making less than $250,000 a year will see any form of tax increase. Not your income tax, not your payroll tax, not your capital gains taxes, not any of your taxes. By the way, politicians usually speak in language that allows us some wiggle room. There's no wiggle room in that particular promise. There's a list here of all the times that that promise has already been broken. Already been broken. We got the last one, the most recent addition to that list, last week with the Supreme Court decision, which told us what we've been saying from the very beginning, which is that this is yet another tax on families that make less than $250,000. What a great opportunity we have, all of us, both sides of the aisle. We have the opportunity to keep a politician to his promise. And we can do exactly that by passing this bill and repealing this law. With that, I yield back the balance of my time.
Gentleman's time has expired. Gentleman from New Jersey.
I yield myself 1 minute, Mr. Speaker.
Gentleman from New Jersey is recognized for 1 minute.
Thank you, Mr. Speaker. You know, I'm amazed by the comments that the previous speaker made on the Republican side. The fact of the matter is that the Affordable Care Act amounts to a tax cut. Right now in the state of New Jersey, for people that are paying for their health insurance, we estimate that about $1,000 or $1,500 annually from their premium is actually going to pay for those who are uninsured, people that, you know, don't have insurance and have to go to the emergency room and then don't pay their bill. Once the Affordable Care Act fully kicks in, because of the fact that everyone will be insured and all those people who now go to the emergency room and have no insurance will in fact have coverage, for the people that are paying their premium right now, They're actually going to be paying less. It'll be a tax cut because they won't be paying for those people that now are uninsured. And I think it's really incredible because if you think about it, the Republicans always talk about responsibility, personal responsibility. How is it fair that people don't have themselves covered, don't carry health insurance, and they make other people pay for it? I reserve, Mr.
Gentleman reserves. Gentleman from Pennsylvania.
Mr. Speaker, at this time I'm pleased to yield 1 minute. Gentlelady from Kansas, Ms. Jenkins.
Gentlelady from Kansas is recognized for 1 minute.
I thank the gentleman for yielding. Mr. Chairman, our current health care insurance system is badly broken, but the President's Affordable Care Act will only make it worse. It will lead to fewer jobs, more debt, and reduced access to quality care. But most importantly, it doesn't even deal with our primary problem, affordability. How can a more affordable solution result in an $800 billion tax hike? Of the 21 new tax provisions in this law, 12 will target the middle class. Instead of supporting the largest set of tax law changes in more than 20 years under the guise of health reform, we must repeal the law and take the time necessary to replace it with more patient-focused solutions. Pursuing consumer-driven reforms will allow Americans the flexibility to take ownership of their health care costs and the freedom to choose what plan works best for them and their families. I yield back.
Gentlelady yields back. Gentleman from New Jersey.
I'm asked if the gentleman has any additional speakers.
No. We're prepared to close.
Okay. Can I just ask how much time I have, Mr. Speaker?
Gentleman from New Jersey has 3 1/4 minutes remaining.
I'll close at this time. Mr. Speaker, let me say over again, and I know, we've had this debate so many times that it really sounds like, we just keep repeating the same thing, but this is a very important day at some level because the fact of the matter is the Republicans continue with this effort to try to repeal what is probably one of the most important pieces of legislation that has ever passed in the last few years in the Congress and has been signed by the President. And the reason for that is because for the first time, most Americans, probably 98, 99% of Americans, when the Affordable Care Act fully kicks in, will have health insurance. We estimate maybe 30, 40, perhaps more million Americans right now do not have health insurance. There are probably as many who are what we call underinsured. In other words, they can't really buy a good benefit package. Fact of the matter is, by 2014, when this bill fully kicks in, when the Affordable Care Act fully kicks in, you'll be able to go on an exchange, either in your state, anywhere in the country, and find a good benefit package, one that's as good probably as what you would get now under Blue Cross or Blue Shield, good benefits at an affordable price. That is an amazing thing because we've been here for 200 years in this country and we're never able to say that that would actually happen. Now, I heard my colleagues last night in the Rules Committee say, well, we have on the Republican side say, well, we'll just repeal this and we'll come up with a better plan. But they haven't come up with a better plan. They talk about health savings accounts and, malpractice and all these different things that are basically around the edges. They would not pretty much guarantee most Americans, as they do under the Affordable Care Act, that they would be able to access health insurance. The peace of mind that goes with that, and all the things, all the benefits that have already kicked in that would be repealed under this bill. The fact that seniors eventually won't have to worry about the donut hole and will, have their prescription drug coverage no matter how much they actually spend. They'll only have to pay a copay. The fact that so many seniors now have preventative care. The fact that kids up to 26 years of old can go on their health insurance, their parents' health insurance policy. So many people talk to me about that. The fact that pre-existing conditions for women and others no longer a factor in terms of your ability to buy health insurance. The fact there are no more lifetime caps, rescissions, all these discriminatory practices that we've had in the past when you're trying to buy health insurance. I mean, the fact of the matter is, already over the last few years, most of these discriminatory practices have been eliminated. And many people may not even realize that it's as a result of the Affordable Care Act, but the fact is that it is. That's why these discriminatory practices are going away. But I have to say, when I hear the Republicans talk about the repeal, last night the chairman of the Rules Committee said, well, we'll repeal this and we'll do something and be different, and the insurance companies will continue not to have these discriminatory practices. That's simply not true. The insurance companies will go back to the discriminatory practices if you repeal this bill. They'll almost be forced to, because the way this is set up, when everybody has health insurance, then the insurance companies can make enough money, if you will, so they don't have to discriminate. But they'll go back to it if this is repealed. So I ask my colleagues, don't keep bringing this up. This is a bad bill. Let's defeat it now, and let's continue the way we should with the Affordable Care Act in the light of the Supreme Court's decision. I yield back, Mr. Speaker.
Gentleman's time has expired. Gentleman from Pennsylvania.
Mr. Speaker, if this new law is so outstanding, I wonder why the administration has granted over 1,000 waivers to their friends so they don't have to meet the requirements of the law. The President promised not to raise taxes on anyone making less than $250,000. He has broken that pledge 20 times with this new law, many of them impacting the middle class that he promised not to raise taxes on. $800 billion in new taxes. My friends, the American people have a clear choice. Keep this law, pay the new taxes, or take the law off the books. Let's start over again with some real free market reforms. I urge support for the bill, and I yield back the balance of my time.
Gentleman yields back his time. Yep, Michigan and Michigan. Yeah. From Michigan, Mr. Camp is recognized.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
Gentleman is recognized.
We're here today to repeal a law that is both fundamentally flawed and overwhelmingly unpopular. The problem with this law, among its many faults, is it puts government at the center of health care decisions, not doctors and patients. Instead of families and employers deciding what coverage is best for them, the Secretary of Health and Human Services makes that choice. Instead of families and employers deciding what they can afford to spend on insurance, the IRS makes that decision. Instead of families and employers deciding if they even need or want health insurance in the first place, the government mandates they purchase it. This is all about the government. It is Washington knows best, and it's wrong. By virtually every measure, this law is a failure. The price tag of the law has already doubled. Health care premiums are going up. Americans are losing the insurance they have and like. Taxes are being raised by over $1.5 trillion, and 12 of the 21 new taxes in the law will hit the middle class. It increases costs for 9 out of 10 seniors. It's paid for with budget gimmicks that even the government's own actuaries admit are not workable. And according to the Congressional Budget Office, the law hinders job creation, something we can hardly afford after 41 consecutive months of the unemployment rate being above 8%. To put it bluntly, this law is bad for workers, seniors, families, patients, doctors, and employers. And as the Supreme Court ruled, the cornerstone of the Democrats' health care law, the individual mandate, is a massive tax. The Congressional Budget Office predicts that approximately 20 million Americans will either pay the tax or be forced to buy insurance they otherwise wouldn't have purchased. 20 million people. Only 2 states in the U.S. have more than 20 million people, California and Texas. Clearly, this is a major tax with major implications. Democrats have argued that the individual mandate was necessary to improve the nation's health. So what's next? Will they require you to purchase low-fat or low-salt foods or pay a tax because they think it's good for you? House Republicans have heard the American people loud and clear. And we will not let government, let alone the IRS, dictate your health care. We will repeal this law so you're again free to choose your health insurance plan, to choose your doctor, and to choose the medical treatment that best meets your needs. Most important of all, we will ensure you have the freedom to choose what's best for you and your family. And, Mr. Speaker, I reserve the balance of my time.
Gentleman reserves his time. Gentleman from Michigan, Mr. Levin.
I yield myself such time as I shall consume.
Gentleman is recognized.
After 7 decades of frustrated efforts, the Congress and the President acted on health reform. 7 decades this institution wrestled with health reform. Finally, it happened. The Republican answer? Repeal. First, it was repeal Social Security. Then repeal Medicare. Then repeal Medicaid by block granting it to the states. And now, the same old song, repeal health care reform. This Republican Party, the party of repeal captured by the radical right, would now put insurance companies back in charge of health care and repeal coverage for 17 million children with pre-existing conditions, repeal coverage for 6.6 million adults now covered under their parents' insurance plan, repeal tax credits for 360,000 small employers covering 2 million workers, repeal ending lifetime caps on insurance for 105 million, and repeal closing of the burdensome donut hole for seniors' prescription medicines. The Republican Party of repeal says repeal and replace. There has not been a single comprehensive bill proposed by the Republicans at any point in this session or before. Indeed, the only comprehensive health plan presented by the Republicans was put forward by Mitt Romney when governor. And this is how he described his plan as recently as 2010, and I quote, "Right now in lots of parts of the country, if individuals do not have insurance, they can arrive at the hospital and be given free care paid for by government. Our current system is a big government system. A conservative approach is one that relies on individual responsibility. But in my view, and others are free to disagree, expecting people who can afford to buy insurance to do so is consistent with personal responsibility, and that's a cornerstone of conservatism," end of quotes. Well, the ones who are free to disagree are his fellow Republicans. The Massachusetts plan with an individual mandate reflected an original Conservative Heritage Foundation proposal. Indeed, bills with an individual responsibility provision have been co-sponsored by Republicans for 2 decades. For 2 decades. And now, however, they have been captured by the radical right and have taken a 180-degree turn. This repeal bill only deepens and widens the gulf handcuffing this Congress. You know, it's as if we live in 2 different universes. And this is the universe that's lived in by people who have sent letters to me. I quote one, for example, from Warren. "I'm 41 years and was diagnosed with a form of arthritis about 3 years ago. Because the Supreme Court upheld Obamacare, I don't have to worry anymore. I know that I can't be dropped from my insurance carrier." And a letter from Pamela of Madison Heights talking about the premiums that she has had to engage with. This is a nurse. She's seen how many people have been engaged with these costly premiums. And she says, "I have watched those who have to undergo painful procedures, or those who have been given a poor prognosis because they have not had access to preventative or even standard medical treatment due to the cost." She says the Affordable Care Act is right and just. And from David in St. Clair Shores, who says, "Honestly, I am a Republican, but I don't believe the health insurance bill should be repealed. I would look forward to see compromise towards improving the legislation rather than destroying it entirely." And then from Nancy of Clinton Township, who writes this: "The part of the CARE Act that is most important to my family, even my Republican husband, is the provision for our college-age daughter. Our insurance dropped her at the age of 19, and we had to buy a separate policy that was very expensive and had poor coverage. Now we can save several thousands of dollars a year, which helps her with education. And it makes me sad that more people don't understand how wonderful this is. I would like the message to get out to more people." It makes me sad, she says, that more people don't understand how wonderful this is. You know, middle-class families have had lots to worry about since trying to recover from the worst recession in decades. So instead of making it harder for them, putting insurance companies back in the driver's seat, we should be doing this. I'm on the Ways and Means Committee, the ranking member. The chairman is here. We've had jobs bills thrown into the hopper that never come forth. So today we're going through the motions of repealing for the 32nd time. What we need for the first time is to get the bills that are lodged in Ways and Means on jobs, get them out on the floor, and work together instead of against each other and against the interests of the American people. I reserve the balance of my time.
Gentleman reserves. Gentleman from Michigan, Mr. Kemp.
I would just note that our health care bill was the only bill scored by the Congressional Budget Office that actually reduced premiums. I would now yield 2.5 minutes to the distinguished chairman of the Health Subcommittee, the gentleman from California, Mr. Herger.
Gentleman from California is recognized for 2.5 minutes.
Thank you. Mr. Speaker, we've heard many perspectives on what the Supreme Court did in its health care ruling. I want to focus on what the Court's decision did not change. The Supreme Court's ruling did not change the fact that the Democrats' health law makes it more expensive for employers to hire workers. Businesses in my district have put their expansion plans on hold because they are worried about higher costs. This law was bad for jobs when it was passed, and it's still bad for jobs now. The Court's rulings did not change the perverse incentives in the President's law that will encourage some employers to drop their health benefits. Millions of Americans will lose the coverage they have and like. That was true when this law was passed, and it's still true now. The Court's rulings did not change the failure of the President's law to reduce health care costs. The administration's own Medicare actuaries concluded that this law will actually increase the overall cost of health care, and CBO found it will raise health care insurance premiums as well. This was a serious failure when the law was passed, and it's still a serious failure today. The Court's rulings did not change the 21 new taxes in the Democrats' health care law. In fact, the ruling highlights how the President's law raises Americans' taxes to pay for an unsustainable new program at a time when unemployment remains far too high. These tax hikes hurt our economy when they were passed, and they're still hurting our economy today. That's why I began advocating for repeal of this bad law as soon as it was passed, and why I still support repeal today. Vote yes for repeal.
Gentleman from Michigan, Mr. Levin.
I yield myself 15 seconds.
Gentleman is recognized.
If repeal occurred in California, it would mean the loss of coverage for 435,000 young adults. It also would mean over 12 million Californians would lose the ability to be sure that their lifetime limits would not kick in. I now yield 3 minutes to the gentleman from New York, a very distinguished member of our committee, Mr. Rangel.
Gentleman from New York is recognized for 3 minutes. Without objection. Gentleman is recognized.
My colleagues, I know that history would reflect that this presidential election started much earlier than most of them do. As a matter of fact, it started the very day that President Obama was sworn in. And the honesty of this Republican Party was for them to say that the strategy for getting back the White House was to make certain that their primary job was to get rid of Obama. The destruction of the President of the United States and everything he stood for, every piece of legislation, every idea had to be destroyed as their strategy, not for America, but for their party. Well, I assumed that this was just political rhetoric. I didn't put too much importance attached to it. But when the debt ceiling came, I felt it was just a little Republican ploy of playing chicken to see how much they could get. But when I saw they were prepared to allow the fiscal integrity of the United States of America and what it represented to go down the drain just to embarrass the president, then I was nudged to take another look to see just how far would they go. And then comes recently the Attorney General, where we just didn't seem to care what kind of bad history we were making for this great republic. We were going to, the first time in history, hold him in contempt and turn it over to the Justice Department to see what they could do to the president. And then, of course, comes the tax cut for 98% of the American people. I never heard in Political Science 101 how you tell 98% of American people that they're going to be held hostage for a tax cut or continuation of the tax cut that they had. But I think when it gets to health care, you don't have to be religious to understand that you're talking about a right to live, a life to improve the quality of your life, a life to give children, not necessarily your children, but any child, a better way of life, the ability to be able to say that even if you had a precondition, you are entitled to health care. And when someone comes up with this grand idea, the whole thing that it is the person who thought about it that decides whether you're going to either support it, repair it, make it better, perfect it, but to repeal it and to leave nothing out there except that, trust us, we're going to replace it. It is so unfair to the American people that could only dream that one day health care would be something that as an American, as a human being, they would be entitled. The things that are happening now by the majority party in this House is very contagious because a lot of young Democrats think this is the way to govern. A lot of Democrats are coming here thinking that the more mean you get, the more successful. It's bad for this Congress, and it's bad for our great country.
Gentleman's time has expired. Gentleman from Michigan, Mr. Camp.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to the distinguished chairman of the Select Revenue Subcommittee, the gentleman from Ohio, Mr. Teaberry.
Gentleman from Ohio is recognized for 2 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Speaker. The President said throughout the debate of health care and cents, if you like what you have, you can keep it. Employers have told us that's simply not true. The President said throughout the debate and cents on the health care bill, the mandate is not a tax. A couple weeks ago, the Supreme Court disagreed and said the mandate was a tax. Today, in this Capitol, an executive with White Castle, a company headquartered in my hometown of Columbus, Ohio, a family-owned, family-run business with almost 10,000 employees. They've been providing health insurance to their full-time employees since 1924, and he testified today that the bill is a tax and that it will impact their ability to provide health care to their employees. Their health care may be too generous and they'll be taxed. Their health care may not be generous enough and they will be taxed. Furthermore, he testified that White Castle will not expand. They've put on hold expansion of 400 to 500 jobs that would be created with their expansion beyond the 12 states they're in. One day I got a call from another employer in my district with 48 individuals. He had just come from his tax preparer who told him not to expand his business. Not to expand his business. He provides health care to his employees, but he was told not to go over 50 because he'd have to comply with the federal government and the federal bureaucracy, new rules, new taxes, new regulations. And we're supposed to grow our economy, he said to me, Pat. We're supposed to grow our economy, the private sector. Ladies and gentlemen, CBO estimated that this bill will cost 800,000 jobs by 2021. This is not a common sense bill that became law. Let's repeal the bill and replace it with provisions that will expand access and affordability. I yield back.
The gentleman yields back his time. For what purpose does the gentleman from Utah seek recognition?
I extend to the desk a privileged report from the Committee on Rules for filing under the rule.
The clerk will report the title.
Or to accompany House Resolution 726, resolution providing for consideration of the bill H.R. 4402 to require the Secretary of the Interior and the Secretary of Agriculture to more efficiently develop domestic sources of the minerals and mineral materials of strategic and critical importance to United States economic and national security and manufacturing competitiveness.
Referred to the House calendar and ordered printed. Gentleman from Michigan, Mr. Levin.
I now yield 2 minutes to the distinguished member from Washington, a member of our committee, Mr. McDermott.
Gentleman from Washington is recognized for 2 minutes. Without objection. Gentleman is recognized.
Mr. Speaker, I love this cartoon. According to the Republicans, we're out here raising the biggest tax on people ever. Now, in this cartoon, you'll see the woman got into her car. She didn't put her seatbelt on. It was a choice, right? She's now being fined. But she says, no, it's the biggest tax increase in history. That's what's going on here today. It is a joke. There is, with the individual mandate, everybody gets a choice. Whether you're going to put your safety belt, your health care safety belt on or not. The principle of personal responsibility, if you can buy health insurance and can afford it, you have to buy it or pay a penalty. Now, otherwise you're passing the cost on to us. You're a freeloader. The Republicans are glorifying freeloaders, people who say they don't want to pay if they can. Now, the Speaker said, don't spike the football if we win in the Supreme Court. What you should have said was, don't kick the water cooler. What's going on the floor today is another pointless, time-wasting exercise. It's the 31st time the Republicans have tried to repeal the bill. Now, as a psychiatrist, I'm qualified to say this. One definition of insanity is doing the same thing over and over again and expecting a different result. The game is over. The referee, John Roberts, blew the whistle. It's over, guys. Why don't we have the Speaker call us when we're ready to get down here and talk about real things like jobs and the economy, and stop giving people the idea that they're going to be scared to death. Less than 1% of Americans will choose to be irresponsible and not buy health insurance if they can. Vote no on this bill.
Has expired. Gentleman from Michigan, Mr. Camp.
Thank you, Mr. Speaker. I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Louisiana, Dr. Bustani.
Gentleman from Louisiana is recognized for 2 minutes.
Thank you, Mr. Speaker. As a physician with over 30 years experience, clinical experience, taking care of patients as a cardiac surgeon, I'm certainly familiar with the problems in our health care system, and there's no denying we need to do substantive reforms. But, Mr. Speaker, this law has not created the kind of reforms that are needed for our health care system. Let's talk about seniors for a moment. This law cuts over $500 billion out of the Medicare program. It's going to hurt seniors. I know this from my own personal experience, having dealt with seniors and seniors' health care. We have not fixed the mismatch between cost and reimbursement. This is leading to accelerating access problems for seniors and others to good, high-quality health care and a good doctor-patient relationship. It's going to force seniors to travel further, to wait longer, depriving them of regular access to a physician that they know and trust. We haven't solved the problem of portability. Portability is something Americans cared about. Owning your own health insurance and carrying it wherever you go. We have ways of dealing with that. That has not been solved with this law. Taxes. Nearly $800 billion now in new taxes, and the total keeps growing. 21 new taxes on every aspect of the American economy. There's no wonder this economy's in the doldrums. There's no wonder we have 41 quarters of unemployment exceeding 8%. This is unacceptable. Another 800,000 jobs at risk, as my colleague mentioned earlier. Plus, the CBO reports that the health insurance tax, something that hasn't been talked about much on small businesses, will be passed through to the consumers in the form of higher premiums for private coverage. Experts also warn that the law will cause massive disruptions in how medicine's practiced. It will accelerate the demise of the independent practice of medicine, which is a threat to the doctor-patient relationship, creating all kinds of conflicts of interest, from a bureaucratic board telling physicians what to do to all these other bureaucratic entities between the doctor and patient.
An additional 30 seconds.
Gentleman's recognized for an additional 30 seconds.
This one-size-fits-all approach is a disaster, and that's why we must repeal this bill in the name of quality, in the name of cost, and in the name of getting this economy back on track. I yield back. Thank you, Mr. Speaker.
Gentleman yields back. Gentleman from Michigan, Mr. Levin.
I yield myself 10 seconds.
Gentleman's
the
recognized.
gentleman from Louisiana voted for the $500 billion in Medicare savings twice. You come here and criticize, I guess, yourself. I now yield 2 minutes to the gentleman from Georgia, distinguished member of our committee, Mr. Lewis.
Gentleman from Georgia is recognized for 2 minutes.
Mr. Speaker, we have been down this road before. We've been here 31 times before, voting to repeal the Affordable Care Act. We're wasting time. The American people are suffering. They have lost their jobs, their homes, and more than 50 million uninsured are worried about whether they're one illness away from disaster. The Affordable Care Act was a historic and necessary step to cover all Americans. And all the Republicans can say is repeal. These are the same forces that fought against Medicare and Social Security. The people get it. If it were not for Medicare, where would our seniors be? Where would they turn? Health care is a right, and it is not a privilege, not just for some people, but for all people. We cannot and we will not go back. Do you want to go back? Do you want people to be afraid to have a checkup? Do you want the only doctor people see to be in an emergency room? The Affordable Care Act is moving us away from this tragedy and toward insurance coverage for all Americans. We have come too far, suffered too long to go back. Too much progress has been made with the Affordable Care Act to go back. The American people will not be fooled this time. Vote no on repeal and get to work putting the American people back to work.
Gentleman's time has expired. Gentleman from Michigan, Mr. Camp.
Thank you, Mr. Speaker. At this time, I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentlewoman from Tennessee, Ms. Black.
Gentlelady from Tennessee is recognized for 2 minutes.
Thank you, Mr. Chairman. Mr. Speaker, I'm incredibly disappointed by the Supreme Court's ruling to uphold the President's health care law. But one thing the Supreme Court's decision does not change is the need for Obamacare to be repealed immediately. The fact is that President Obama's signature legislative achievement, Obamacare, is a tax hike on the middle income class. Since I took office in 2010, I've been fighting every day to repeal Obamacare, and I will not rest until this goal is achieved. As a small businesswoman and a nurse for over 40 years, I know that Obamacare is not only the wrong medicine for our health care system, it's also a disaster for our economy. Obamacare's new regulations, taxes, and mandates are crushing our already weak economy. Now, 3/4 of the small businesses say that the law is preventing them from hiring people, and that has left millions of middle-class Americans jobless and without a way to provide for their family. I look forward to voting tomorrow once again to fully repeal Obamacare, and I hope this time that the Senate gets the message loud and clear. It's long past time for the Senate to follow the House's lead and strike down this disastrous law. Thank you, and I yield back my time.
Gentleman yields back. Gentleman from Michigan, Mr. Levin.
I yield myself for 15 seconds.
Gentleman is recognized.
In Tennessee, as of December 2011, 59,000 young adults in Tennessee gained insurance coverage because of ACA, and almost 800,000 with Medicare received free preventive services. Almost 800,000. I now yield 2 minutes to the very distinguished colleague of mine from Massachusetts, a member of our committee, Mr. Neal.
Gentleman from Massachusetts is recognized for 2 minutes.
I hope as this debate ensues, what we can perhaps call this for the next hour, instead of Obamacare, why don't we call it Romney Care? This is based upon the Massachusetts model that Governor Romney signed with Ted Kennedy standing next to him. Anybody who knows anything about insurance markets, you know the following. You can't say, as our Republican friends are saying, by the way, in print and in televised appearances, they're all saying, oh, I like the idea of ending pre-existing condition. Oh, I like the idea of keeping 26-year-olds on their parents' health insurance. Oh, I very much like the idea of ending lifetime caps. Oh, I very much like the idea of preventive service mammography screening and osteoporosis for women. Well, that's what's in the legislation that we passed. Those numbers poll very well with the American people. And by the way, the trend line continues in this direction. But if you know something about automobile insurance, it's not just on Friday night you driving along knowing you have insurance that you need to be concerned about. It's the man or woman driving the other way towards you hope has automobile insurance as well. The Massachusetts plan polls very well. Not everybody in Massachusetts, contrary to what some might think, is a Democrat. Almost 64% of the people in Massachusetts are Republicans and independents. 70% North approve of the health care plan that was duly negotiated with hospitals, the business community, organized labor. Everybody had a seat at the table. Remember this as we proceed to this vote tomorrow. This is the offering that Bob Dole suggested to Bill Clinton. This is the offering that Senator Chafee from Rhode Island offered to Bill Clinton. The mandate was a Republican proposal. It came from the Heritage Foundation, and it's the only bone of contention in this legislation.
Gentleman's time has expired. Gentleman from Michigan, Mr. Kemp.
Thank you. I yield 2 minutes to the distinguished chairman of the Human Resources Subcommittee, the gentleman from Kentucky, Mr. Davis.
Gentleman from Kentucky is recognized for 2 minutes.
Thank you, Mr. Chairman. Mr. Speaker, I rise today in support of H.R. 6079, the repeal of Obamacare Act. Though the Supreme Court's decision is disappointing, it does not change the underlying truths of the President's health care law. The law has neither reduced costs nor improved choices available to Americans. It outsources Medicare decisions to an unelected rationing board, interferes with the doctor-patient relationship, and threatens consumers with fewer options and higher premiums. The health care law is paid for with more than $800 billion in new taxes and another $500 billion or more in Medicare cuts. All told, we're left with 21 tax increases, including the individual mandate, which for the first time in our country imposes a federal tax for inaction. Imagine what a future Congress could tax you on for not doing: not eating fruits and vegetables, not buying an electric car, not exercising daily to their standards, just to name a few. The possibilities of Congress's taxing power are seemingly endless and frightening. On top of that, the Internal Revenue Service is now the official enforcement cop for the health care law, a powerful role requiring the hiring of thousands of new IRS employees at an expense of hundreds of millions of dollars. The takeaway, young or old, the health care law does little to ensure affordable coverage for all Americans. We'll not feel the full brunt of its impact until 2014, but the law has already proven to be a nightmare. We can't mistake the Supreme Court's ruling for an evaluation of good policy. At the end of Justice John Roberts' majority opinion is an important message. He writes, and I quote, "The Court does not express any opinion on the wisdom of the Affordable Care Act. Under the Constitution, the judgment is reserved to the people." And judged they have. This law is a disaster for patients, small businesses, and future generations of Americans. We must repeal it and redouble our efforts to start anew on real process reforms that will increase patient access and quality of care while reducing costs. I yield back.
Mr. Gentleman's time has expired. Gentleman from Michigan, Mr. Levin.
I yield myself 20 seconds.
Gentleman is recognized.
Well, there's a reference to disaster in Kentucky. Here are the facts. 48,000 young adults in Kentucky gained insurance coverage. Since it was enacted ACA, Kentucky residents with Medicare have saved a total of $68 million. 538,000 people with Medicare in Kentucky receive free preventive services. That isn't disaster, that's progress. I now yield to Mr. Thompson. He's right here. 2 minutes. Our distinguished colleague on the Ways and Means Committee.
Thank you, gentleman from California is recognized for 2 minutes.
Thank the gentleman for yielding. Mr. Speaker, I rise in opposition to this legislation that represents the 31st time that we have voted or will vote to repeal parts or all of the Affordable Care Act. Instead of staging these political games, we should be spending our time strengthening the reforms that were made in the Affordable Care Act and working together to put people back to work. The Affordable Care Act was passed in response to a national crisis. Businesses and individuals could not afford to buy health insurance. Hospitals, doctors, and clinics provided more than $100 billion a year in uncompensated care, $50 million in my district alone. Now, the good fairy doesn't come and reimburse them for this care. These costs are passed on to all of us who have health insurance in higher taxes and higher premiums, to the tune of $1,000 a year in higher health insurance premiums. People with pre-existing conditions could not get coverage. People in my district were hitting their lifetime caps or even annual caps and being dropped by their insurance company. Others were self-employed and simply couldn't afford to buy private insurance on the open market. This was the national crisis that we worked to try and fix. And this is the national crisis that the majority party would like to go back to. It's not right, and it's not good for America, and it's not good for Americans. So on behalf of the millions of Americans who are already benefiting from the Affordable Care Act, I urge a no vote on this legislation, and I yield back the balance of my time.
Gentleman yields back. Gentleman from Michigan, Mr. Camp.
At this time, I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from Illinois, Mr. Schock.
Gentleman from Illinois is recognized for 2 minutes.
Thank you, Mr. Chairman. And Mr. Speaker, I wish to rise and offer a few facts. You know, there's been a lot of opinion going around here today, but we're all entitled to our own opinion, but we're not entitled to our own facts. President Obama famously said, and I quote, "If you like your health care plan, you will be able to keep your health care plan, period." End quote. The Congressional Budget Office released the fact that 20 million people are expected to lose their health insurance coverage if this law stands. 20 million Americans who currently have health insurance will lose it under this plan. Fact. Why? Because of bad provisions of the bill. 71 out of the Fortune 100 companies will save $422 billion by eliminating their employer-provided coverage and opt instead to pay the $2,000 per employee penalty instead. It incentivizes bad behavior, precisely the opposite of the stated goal. Another claim the President repeated was, quote, "Under my plan, no family making less than $250,000 a year will see any form of any tax increase, period," end quote. Yet, only after much reason, Obamacare was found constitutional. The primary reason that Chief Justice Roberts, joining with Stephen Breyer, Ruth Bader Ginsburg, and Elena Kagan, along with Sonia Sotomayor, upheld the individual mandate is under Congress's taxing authority. The truth is 76% of those paying this new individual mandate tax in 2016 will in fact be individuals who make only $59,000 or a family of 4 who makes $120,000, far below the threshold, the promise, and the guarantee of President Obama's $250,000. And finally, my friends on the other side of the aisle claim the health care spending would rise by a mere bargain of only $938 billion. There was much to do, I remember, about then-Speaker announcing it was below $1 trillion, yet the Congressional Budget Office has updated their number to cost $1.8 trillion just this next decade. For those reasons and more, we need to repeal this bill. I yield back.
Gentleman's time has expired. Gentleman from Michigan.
I yield myself 30 seconds.
Gentleman is recognized.
There's a reference by the gentleman from Illinois about facts. Let me mention the facts. As of December 2011, 125,000 young adults in Illinois gained insurance coverage. Since it was enacted ACA, Illinois residents with Medicare have saved a total of $155 million on their prescription drugs, and 1,350,000 people with Medicare in Illinois have received free preventive services. Those are the facts about health care reform. I now yield 2 minutes to the gentleman from Oregon, another very distinguished member of our committee, Mr. Blumenauer.
Gentleman from Oregon is recognized for 2 minutes.
Thank you. I appreciate the gentleman's courtesy in permitting me to speak on this bill, and I appreciate him framing the difference that the legislation makes. That's why, in a sense, I welcome the 31st running of this soap opera here on the floor of the House, where our Republican colleagues have attempted to repeal the Affordable Care Act. It would have a little more credibility if they actually had a meaningful alternative that would take the place, that would do the things that this legislation is in the process of doing. Bear in mind that this legislation over the course of the next 20 years is going to reduce overall government spending by over $1 trillion. It reforms Medicare, not by slashing benefits to senior citizens, but by changing the priorities and the overpayment for Medicare Advantage, which does shift, as my colleagues say, $500 billion. But it uses it to reform Medicare and pay for medical benefits for the American public. What my friends on the other side of the aisle don't say is that they take the $500 billion, but they don't invest it in strengthening Medicare. They use it in their budget, the same $500 billion, to finance tax cuts for Americans who need them the least. The wealthiest, most well-off Americans use this $500 billion for additional tax cuts. What we have done is to move forward, and it has nothing to do with broccoli, because if you don't happen to like broccoli, you don't have to eat it. But what's different is that under this system, people may have an additional.
Gentleman is recognized for an additional 1 minute.
That no one can force the rest of us to buy their broccoli. Unfortunately, the American health care system now is forcing many of us to pay for the uninsured, 60% of whom go to an emergency room or a doctor's office every year. That's why Governor Romney had a mandate or a tax or whatever you call it to be able to move this forward. That's what the legislation is modeled on. It's making a difference already for Americans in terms of young people on their parents' coverage, small businesses, more than 1/3 who've been able to have tax credits to extend health care, and there's more along the way. The more we debate this, the more the American public understands the benefits of the legislation, and the more the support grows. Thank you, and I yield back.
Gentleman yields back. Gentleman from Michigan, Mr. Kemp.
Thank you. At this time, I yield 2 minutes to a distinguished member of the Ways and Means Committee, the gentleman from New York, Mr. Reed.
Gentleman from New York is recognized for 2 minutes.
Thank you, Mr. Speaker. Thank you, Chairman, for yielding 2 minutes to me to address this important topic. Mr. Speaker, I rise today to stand in strong repeal for Obamacare. And I think at this point in time, it is only right and just that we be open and honest with the hardworking taxpayers of America. And that is why it is important that we have this vote on the floor tomorrow, so that the American people, with the backdrop of the United States Supreme Court decision clearly articulating what Obamacare is. It is clear it is a government expansion of 130-plus agencies. It's a significant tax increase with 20-plus tax increases that are now clearly delineated and described by the Supreme Court as such. So when we vote tomorrow, we vote on a clear record. And I gladly came here to Washington, D.C. to stand up to downsize the federal government, to cut taxes, not increase them. And also, as we stand in regards to this repeal, we must be cognizant of the fact that under Obamacare, Medicare is cut $500 billion. There can be no mistake about it. And let us be clear with the American people as we go through this upcoming debate that will be ultimately decided in November, that we need to protect Medicare, preserve it, reform it, not cut it like this bill does. So when the votes are cast tomorrow, I think ultimately the record will be clear, where each and every one of us stands, and I stand, and I hope all my colleagues stand with me to repeal this legislation, which increases taxes, expands governments, threatens the job creators of today and tomorrow with a burden that scares them from making the hiring decisions that are going to put people back to work today, which is the #1 issue that we face in America and that we are here in Washington standing firm to stand for. And with that, Mr. Speaker, I yield back the balance of my time.
Gentleman from Michigan, Mr. Levin.
I yield myself 30 seconds.
Gentleman is recognized.
The gentleman from New York voted on that $500 billion Medicare provision twice, voted for it. As of 2011, 160,000 young adults in New York gained insurance coverage because of health care reform. Since it was enacted, New Yorkers with Medicare have saved a total of $270 million on the prescription drugs. In 2011, 2 million people with Medicare in New York received free preventive services. Since 2010, over 3 million New Yorkers with private health insurance gained preventive insurance. Could I ask the gentleman from Michigan how many speakers he has left? First, let me ask, how much time is there on each side?
Gentleman from Michigan, Mr. Levin, has 7½ minutes remaining. Gentleman from Michigan, Mr. Camp, has 13½ minutes.
I reserve.
Gentleman reserves. Gentleman from Michigan, Mr. Camp.
At this time, I yield 2 minutes to the distinguished chairman of the Trade Subcommittee, the gentleman from Texas, Mr. Brady.
Gentleman from Texas is recognized for 2 minutes.
Thank you, Mr. Chairman. Texas is a big state. We have a lot of poor families, and as a border state, we have a lot of people here who are not legal. As a result, we struggle to provide health care across our state. Obamacare will make it worse, will make it harder to help families. This chart lays out the new health care law that affects every one of you in America. This is the result of that 2,801-page bill in the Supreme Court ruling. What that Supreme Court left in place was 159 new federal agencies and bureaucracies in between you and your doctor. What they left in place was 21 new tax increases, a dozen of which hit middle-class families like yourself right in the pocketbook. What it left in place is $500 billion of cuts to our local hospitals, our home health care agencies, our nursing homes, even hospice cares. When people are dying, they left in place those cuts. And today, you'll hear, when I finish, the ranking member will tell you all the sugar and spice about Obamacare in Texas. What he won't tell you is how many seniors will be forced off Medicare Advantage, their plan, because of Obamacare. They won't tell you how few doctors will even see our seniors anymore in Texas. What he won't tell you is how many small businesses and medium-sized businesses are going to drop their health care plans and move their workers into the subsidized exchanges because of Obamacare. You won't hear that when I finish talking. The truth of the matter is, if Obamacare is so great for families, why are your health care costs still going up? If it is so great for small businesses, why did they sue to stop it? And if it's so great for seniors, how come they can't find doctors to see them anymore? Health care is too important to get wrong, and Obamacare got it wrong. It's time to repeal it, start with a fresh slate, and help the families who need it most. I yield back.
Gentleman's time has expired. Gentleman from Michigan.
I yield myself 30 seconds.
Gentleman is recognized for 30 seconds.
25% of the people of Texas go to sleep every night without insurance. 25%.